That's not good. No, no, that's not good. That's not good. No, no, that's not good. No, that's not good. That's not good. No, 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 not good. No, not good. That's not good.
I am finally unmuted. Yay. Hello, everyone. Hi, Miss Reed. And hi, Richard. How you doing? Liz was on the phone with me trying to keep me on the phone. I'm like, wait a minute. I'm on the phone. They're asking me if I'm ready to go.
All right, Tina, it is live streaming. Should I let everyone in?
Yeah, we're ready. What time are we at now? 3:01, go. No idea. Good afternoon, everyone. I just wanted to say hello and to let you know that we will be starting in a few moments. We're just allowing everyone to come in. As people are still coming in, we're going to go ahead and get started because we want to be respectful of your time. And we want to just say thank you first for those that are here, and thank you for those that are coming in. As we begin, I want to say good afternoon to everyone. My name is Tina Bradshaw Smith. I am a proud Washingtonian, proud DCPS teacher, wife, and mother. I have the honor to be your moderator for this incredible venture today. The first joint town hall between the Washington Teachers Union, the Council of School Officers, Unite Here Local 25, the Association of Supervisory and Administrative School Personnel from Prince George's County, and the DC Coalition of Black Trade Unionism. Hashtag only when it's safe. The purpose of this town hall is to inform, to educate, and to empower through testimonies from various sectors of our DMV family, explaining through science, not politics, that we can only return to in-person learning, hashtag only when it's safe. Now I have a few housekeeping items. One, the chat is private, so please feel free to add any questions or comments as we have allotted time for Q&A. Two, this is an interactive town hall. And with that said, you will be asked to take part in 2 surveys. 3, we also have muted you so that everyone can hear the presentations. And 4, please take a few moments to sign the petition that will be dropped into the chat near the end of the town hall. At this time, I have the pleasure to introduce presidents that I have known for the majority of my career, as well as a few that are fighting the good fight. Let's now welcome Elizabeth Davis, President of the Washington Teachers Union, Richard Jackson, President of the Council of School Officers, John Boardman, President of Unite Here, Local 25, Doris Reed, Executive Director of the Association of Supervisory and Administrative School Personnel of Prince George's County, and Josh Williams, the former President of the Metropolitan Washington Council, AFL-CIO, and current Administrator for the DC Coalition of Black Trade Unionism, who will speak briefly about union unity. And I'm trying to see, has Josh come in yet? I do not see him. Jocelyn, hi, how you doing, Josh?
You hear me?
Yes, we hear you.
All right, thank you very much. My apologies. I'm kind of technologically challenged, so you've got to bear with me. But I'm on now, and I just want to thank you, Tina, for your invitation to participate here, and thanks to all of our sponsors, and most importantly, thanks to the participants who are taking time out today to be part of this urgent conversation.
Mm-hmm.
I am pleased to be a part of this discussion, but Tina, I truly wish that there was no need for our meeting under these circumstances today.
This is true.
For the past several weeks, I and Dr. Reed Tuckson, former DC Commissioner for Public Health, have been working to focus on the dangers of COVID-19 and disproportionate impact that it is having on our community in general and the minority communities in particular. You will be hearing from Dr. Tuckson today. Dr. T, thanks for the great work you have done and continue to do. We are now, let me just say, the role of the trade union movement must be to create and advocate for an environment where working families can live, work, and play without fear of a pandemic. This pandemic cuts across all workers. Doesn't make any difference whether you're an educator, whether you're a white collar, blue collar, no collar. The decisions that are made with respect to this pandemic affects us all, and I emphasize the word all. We are now at the critical point of determining when and if schools will reopen. It is important that unions have a seat at the table in the decision that affect our students, educators, and workers. You are on the front lines, brothers and sisters. You are on the front lines. You shoulder the ultimate responsibility of how safety will be maintained in our schools. You bear the greatest risk that poor, ill conceived decisions will adversely impact you, your students, your loved ones to whom you go home every day, your neighbors, and your community. This pandemic has no borders. It is critically important that the trade union movement, whether you are in the school system or outside of the school system, rally around our brothers and sisters in the educational field. Because today it is them, tomorrow it could be us. The function of the trade union movement is to change and impact our community, and we can only do that if, as a movement, we make no distinctions between whether you are a school worker, whether you are a hotel and restaurant worker, whether you work in the hospitals, no matter what kind of a worker you are. We must all support each other in the struggle, not just for ourselves, but for our community. So I want to again thank the sponsors of this program for reaching out and including others to participate and for us to be able to discuss how we as a movement, Tina, rally together around each other to enforce the definition of a trade union movement, a collection of many for the benefit of all. And what we do today affects us all and is in keeping with the mission of the trade union movement. So thank you for having me. And thanks, Liz, for inviting me. What lady I call the ever ready bunny.
She truly is. Thank you so much for those words, Josh. Josh.
Thank
Liz,
you.
may we now hear from you and the other, and welcome from the other presidents.
Okay, so Tina, did you want me to go ahead and start my comments at this point?
Your welcome comments. Yes, please.
First of all, I want to say thank you, Josh, for being here. But for those of you on the call, I certainly want to thank you for taking your Sunday afternoon to be a part of this important meeting. Josh has a long history with the labor community in DC, 30 years as president of the Central Labor Council, and has been one of my mentors for years. And of course, there are other labor leaders on this call: Doris Reed, Richard Jackson, John Boardman, Dr. Reed Tuckson, who has recently partnered with the WTU with the Black Coalition Against COVID. I cannot tell you how much I appreciate your joining us today, but those individual organizers and teachers who organized this event and are continuing to organize throughout the summer, I cannot thank you enough for the work that you're doing and will continue to do. And I cannot say enough about those individuals who are on the front line, doctors and our nurses. We've got to thank the medical workers and the emergency responders in DC and across the country who are putting their lives and the lives of their family on the line every day. And they're doing it under extremely challenging circumstances, in many cases without the needed PPE and the resources they need to do their jobs. So whatever success we have in battling this outbreak, the lion's share of that work must go to them. And the teachers of DC, the members of the WTU, thank you. Mayor Bowser and I had a conversation on Tuesday. She called to say she needed to meet with me and the chancellor regarding the reopening plan for DC public schools. She set up the meeting for the three of us. And of course, she did most of the talking. Midway through the conversation, I asked her if the purpose of the call was to inform me that we were ready to work together on developing a reopening plan. She answered my question when she said, "The plan has already been developed, Liz. I'm just calling to let you know what it is." So she shared with me the details, 2 days in, 3 days out. And of course, after she finished, I had several questions for her and the chancellor. I wanted her to know that we had polled our members, and we will continue to poll you because we need to know how many of you have underlying health conditions, how many of you have school-aged children at home, how many of you live outside of the district, and you responded. And that information, that data is basically what we've used to put in our ReOpen task force, which was developed by over 200 teachers over the course of 6 weeks, with all of the details of how we can reopen pre-K-12, early grade, special ed, ELL. That is the most, in my opinion, report that the city has to follow as guidelines for reopening DC public schools. However, did the chancellor or the mayor pay attention to it? They said they read it. I did not get any sense in the plans that Mayor Bowser announced to me on Tuesday evening that they had implemented or included any of those recommendations in her plans to reopen. So at the end of that conversation, I had several questions for her. We were able to get answers to 3. 1, 40% of our members live in PG County, Mayor Bowser. 60% of them reported underlying health conditions. What plan is in place to address the needs of the working teachers who will have to be on the front lines to make this plan that you have worked? Well, Liz, there is FMLA and there's ADA. And I said, well, Mayor Bowser, I didn't say that these teachers were sick or bedridden. They simply have underlying health conditions. What is the plan to accommodate them? Will there be an option for them to do virtual only? Because at the beginning of that conversation, I informed her that I thought it was a better idea for us to open virtually 100% until the WTU and DCPS could work together to come up with a plan that would be safe for school workers, teachers, and students. One that parents would be comfortable with, because they're certainly not comfortable at this point. The second thing is parents nor teachers have been provided sufficient information to make any plans for the fall. They have no idea who will be called to do in-person teaching. They don't have no idea about scheduling. No detailed plans from DC Public Schools on how the schools will reopen, other than you have to trust us. And for those of you on the call, I don't need to go any further about trust. Teachers know better than anyone what conditions existed in their schools before the pandemic. And they're also aware of promises that were made for renovation, fixing, cleaning in schools that never happened. My virtual meeting with teachers in basic schools throughout the summer, and we're continuing those meetings, we received reports that many of the schools did not have paper towels, toilet paper, sanitizers before we closed. But the chancellor and the mayor is expecting us to trust that all of these safety protocols defined by the CDC, by the Office of the State Superintendent of Education, by the DC Department of Health, are going to be in place when you return to your schools on August 31st. Well, the mayor basically, we could not reach an agreement. She basically announced at the end of that call, this is what I'm announcing on Thursday morning at my press conference. I was invited to attend. I was not interested in being there because we could not, it would have given the appearance that we were together on the plan. Well, on Thursday morning, I received a text from one reporter saying, Liz, the mayor has just announced that she's going to delay. And of course, during our conversation, when I informed her that 40% of our teachers live in PG County, what happens if PG County has a plan that is different from ours? She said, we'll cross that bridge when we get to it. Well, that bridge opened up on Thursday because PG announced that very morning that they were going to open with 100% distance learning. And of course, that is certainly going to have an impact on DC Public Schools. I have no idea why she delayed her announcement. Whatever her announcement is going to be 2 weeks from now, what we do now and in between, I'm hoping is going to influence her to make the right decision, the smart decision, which is to open DC Public Schools 100% virtually. until we can get better control, more resources to be able to open school safely. PPE, schools sanitized, screening, contact tracing, all of those protocols, according to the Office of the State Superintendent of Education, must be in place before any DC public school building open. And we're anticipating that DC Public Schools is going to develop a plan that will comply with those protocols established by OSSI and the State Superintendent of Education, as well as the CDC. And of course, I do not want to, at some point, I'm really looking forward to hearing from our other labor leaders, and I'm so excited that they joined us today, because one thing that labor leaders understand more than anyone else is if there's never been a time for solidarity, it is now. The second thing is we also understand that labor has basically been in this country, as Josh indicated, the organizations that basically fought for social justice, civil rights, human rights, and they continue to be. So I'm excited to see that we're understanding the power of our collective voice, because the organizing that we're doing this summer as a union is all about building our capacity, building our collective voice, and making you understand as our members that the power of what happens to you in this profession does not rest with 2 or 3 people. It rests with 5,000 of us plus our allies. So at this time, I know that there are a couple of the organizers that I'm going to ask, so that I do not dominate the time, to talk about some of the recommendations that we've made, not only to DC Public Schools, but also to the DC Council and to Mayor Bowser around the digital divide. We knew that there were inequities in DC Public Schools. We've known that for decades. But this pandemic has amplified, magnified those inequities in ways that we cannot imagine. We knew there was a digital divide. We knew that students would be out of school and could not access learning online. We discovered how many, almost 35% of our students.
Well, Liz, before you go further, I just wanted to break in just a little bit, just to have the other leaders just bring a few words of welcome, because you are giving us so much information and I'm loving it. And I know everyone else is, but we just we want to try and keep it going.
And thank you for moderating well, Tina. Okay.
You're welcome. Ms. Reed, I see your face and I see you and I know you're ready to go for it. Can you bring us a few words of welcome from Prince George's County?
I certainly can.
Thank you.
I want to thank Liz for including me in this today. I really appreciate it. We definitely are in this together. There's no question. We all have the same issues to deal with. Fortunately for us, our CEO seems to have a bit more sense than most and has declared, as Liz said, that we will be starting school in August 100% distance learning. Why people don't understand that that is the way you have to go is beyond me. It is not possible to bring these students back into school safely. If you have a school with 2,000 students, there's no way, even if you bring them back half at a time, that you can socially distance. It's just not possible. And I mean, those are the facts. I don't understand also why people think because you declare schools must open, that parents are going to automatically send their kids to school. I mean, if you be honest about it, some of them couldn't get their kids to school before COVID-19 hit.
Oh, you just hit a nerve.
So, yeah, all right, but you know, it's the truth. So what is suddenly going to change? Now they have a reason for not sending them to school, you know? But we're all aware of the importance of the education of students. That's not even a question. But we can't overlook their safety, the employee safety, the community safety. Because you know, if they come to school, COVID-19 gets spread, it goes back to the families, it goes to the families of the employees. It's like, and everything else that you've had in school, that gets spread around. And when you're looking at Prince George's County and looking at, we had the largest number in the state of Maryland for COVID cases, why would you think that those teachers and those employees in DC that live in Prince George's County are going to want to come over there? Or more importantly, why would you want them to come over there? You're not even thinking this whole thing through. It just doesn't make any sense. And I believe that school employees do want to come back to work, but they want to do it safely. It's not like they want to just stay home. I know most of them are probably going insane at home, but they're not going to come back and die for a job. Let's be real. Okay. I don't know what people are looking at. I mean, these politicians need to stop. This is not something that should be politicized. You know, if you're going to run for election, run for re-election, that's fine. But don't do it on dead bodies of people that you don't give a damn about. Because that's exactly where we're going if you push this thing to make people come back at this time. It just does not make any sense. And I don't think people realize that there are a lot of school system employees who have been in the buildings and in the schools the whole time. The custodians never went home. They're the ones that have been there having to clean and sanitize all these buildings. The food services people have been there the whole time. Prince George's had 80 something sites for meals. Employees had to be there giving those meals out. These people are out here on the front line through this whole process. They're taking care of other people's children, frankly, at the risk of their own children. And why your mayor and other politicians don't respect that, don't understand that, is just beyond me. You know, if she needs to make a call over to Prince George's, I'm sure Angela also Brooks or Monica Golson will help her understand. Because like I said, you guys, we're just across the street from each other. We have to work together. And I will just, you know, offer this. I'm here. Anything that I can do, Richard, Liz, that I can offer, you guys know where I am, just give a call. Thank you.
Thank you so much, Ms. Reed. As a Prince George's County resident at this time, I do understand. I do understand. And we're now going to hear from my friend who I've known forever, Mr. Richard Jackson.
Well, thank you so much, Tina, and thank you, Liz, for inviting me. For those who I haven't met, I'm Richard Jackson, President of the Council of School Officers. We are the in-school counter voice with WTU, and we stand 100% in line with WTU. Our members have said very clearly that we want 100% virtual learning. And in fact, in my conversations with the Chancellor and with his leadership team, we've shared our concerns around two rubrics. Our members shared over 8 pages of operational concerns. And we've approached this thing from an operational and a health and safety standpoint. And so as the politicians are talking about schools being open, it is our members who have the duty of making all these illusory ideas come happen. Now, what we're challenged by, and I want my teacher union members to understand, is we have as little information as you guys have. And our concern has been the same concern I've shared with the Chancellor and city officials, is that you cannot open schools without being in concert with both teachers and school leaders. And so to give you an example, there were over 1,000 outstanding work orders with DGS that our principals had put in, that's even related to air quality, that's related to plumbing, that's related to those areas. A simple question we ask is, if you're saying there's going to be distance learning, what does that actually look like in cafeterias? What does that look like in restrooms? You know, if you say someone is going to take your temperature at the door, who is that person? And what happens when they do discover someone whose temperature isn't right? We've asked the hard question, which we receive what we call crickets when we say, what happens when, not if, someone tests positive? What are the protocols that have been articulated around what do we do? The response that I received was a kind of an administrative response. And the question was still, what is said to teachers? What is said to the community? What is said to students? What are those school leaders supposed to do? So we're talking about in-person, having in-person schools, and have shared at this moment little to no information to our school leaders. So many times teachers are asking our school leaders, what's going on? And they and the upper leadership have shared little to nothing. So we stand in concert with you. Liz and I have been talking about doing some things jointly. We stand in concert with you around school should be 100% virtual. And then we should really be spending this time ensuring that the virtual learning has the depth and the quality that it may not have had the first time we tried to do it. That's where our efforts should have been. We shared the lunacy of trying to do this summer bridge program. Whoever came up with that, I simply asked a simple question. I want to be there when you explain to that first person who gets sick, whether that's a teacher or a student or a community member, because you wanted to bring someone back in school 2 weeks earlier. Luckily, just like with Liz, we found out that they were going to go 100% virtual because, again, they don't want to talk with the unions. They want to tell us what's going on. And so I think together we can, if we continue to push, and I think we've been doing a great job of pushing together we can push this the way that it needs to be. That's in the best interest of students, in the best interest of teachers, and the best interest of our community. I just want your members to be fully aware that your school leadership have the same ideas. We may not verbalize it as loudly because in some instances we have to be able to tell upper management, how things are landing, but we are in total concert, and the Council of School Officers is really pushing as much as WTU to ensure that in the fall we're 100% virtual learning. So thank you for inviting me, and I appreciate being here.
Thank you so much, Richard. Thank you, thank you, thank you. That's one thing that we really need to hear as teachers, that our administrators are with us.
Oh, we're here. We're in the same building with you.
There it is. And I would like to ask our last president, Mr. John Boardman. I'm sorry, I'm about to say the wrong name. Mr. John Boardman from Local 25. I don't see you right here, but could you bring us a few words of welcome?
Thank you, Tina. Let me start out by thanking Liz and the Teachers Union for hosting this event. And I also want to say hello to some old friends, Doris and Josh. And I'd like to say hello to Richard as well. And I want to thank all of those of you who are taking the time out on this Sunday to be on this call. I want you to know that I have 3 union teachers in my family. I understand this issue. It is a topic that consumes our family discussions of late. And I also want you to know that Local 25 members need teachers to educate their children, but only if they can do so in a manner that both are safe and healthy. 93% of Local 25's members who are predominantly in the hospitality industry are out of work, and they are unlikely to return to work for more than a year. We are right now engaged in the same kinds of fights that you are with employers to implement protocols to ensure that when we're at work serving guests and doing the jobs that we do, that we can do so in a safe and healthy manner. The virus is a great equalizer, and we are all at risk, and all of our individual safety is tied to the larger whole. We are all in this together, and I thank you very much, Tina, and to the teachers. Wish you the best of luck, and also the best to all of you who are on this call today. Thank you.
Thank you so much, John. And thank you to everyone. Okay, so are we ready? As I told you, this is going to be interactive. Okay, the teacher in me is coming out. Here we go. The first poll question. Can we have that part? There we go. Have you or someone you know been affected by COVID? This is anonymous. It's just a yes or no, or you're not sure. Go for it. Give it a couple of minutes. Laura, how are we doing on that? Okay. So there have been a few quotes that have been posted in the chat. This is one quote, and it says, and it states, "I don't qualify for FMLA, and I do not feel safe going back. I am seriously considering quitting my job after hearing about her hybrid reopening model this week." Why does one of our teachers have to quit? Because we have a mayor that is not being she's not going according to the science. Why does that have to happen? Okay, let's see. Okay, so we're going to move on. Here we go, ladies and gentlemen. Thank you so much for participating in that quick little poll. We have many partners. As you can see, we have partners on the union front as well as partners in our community. And today we're going to hear from just a few of them. Our first partner we're going to hear from is Empower DC, and that is going to be Mr. John Hutto. Let's go for it.
All right. How's everyone doing out there with the Washington Teachers Union? This is Jonathan Hutto, community organizer with Empower DC, and just giving you a synopsis, if you will, of an experience, not a experience, the experience that I have experienced on the ground in Ivy City, where my organization, Empower DC, has been engaged in mutual aid during this COVID crisis. Let me say that in many quarters of Ivy City, it is literally a life and death situation in terms of what the people are engaged within. And so we have a populace of our supporters who need our mutual aid in order to survive. As the Black Panther Party stated decades ago, not just mutual aid, but these are literally survival programs. I'm not going to drop any names of any families or any members, but I will say that it's a dire situation, and it's one that right now the people are depending on what we actually do. So right now it's not about who you say you are, what you profess to be, or even what you hope to be. In this very hour, we are what we do. And that's what we're doing in Ivy City is Empower DC. We're taking action. We are what we do, impacting people's lives, ensuring that people have bread on their tables, that people have sustenance for their lives, so we can survive and push through this COVID crisis one day at a time.
Only
Powerful, very powerful. We are what we do. Our next video comes from our community partners across the bridge in Northern Virginia. As we know, DC and Northern Virginia have entered phase 2 of the reopening process at the same time. As we also know, there are many teachers that live in Virginia, and we know that their families will be disproportionately affected if DC returns to in-person learning before it's safe. Let's see what can really happen.
The first thing that you have to know about COVID, to think about this, is that COVID is slow moving. If I were to be infected today, then I'd be contagious in a day or so, but I probably wouldn't show any symptoms for a week. It would probably be a week after that before I got bad enough to go to the hospital or get a test, if I ever did. And it could well be a week after that before the fact that I'm ill actually becomes part of the statistics that you see reported every day. What that means is that there's a 2 to 3 week lag between when someone becomes infected and when they show up in the case counts that are used to set policy. The other way to look at that is to say that the information that you have today isn't telling you about what's going on today. It's telling you about what was happening 2 or 3 weeks ago. Mm-hmm. To show you why that matters, here are Virginia's case counts going back to May 1st. And what you see, your phase 1 reopening in the north was on May 29th. And if you look at it, you'd say, hey, how about that? Our numbers were still coming down after phase 1 reopening. That's great. And then you look at phase 2 reopening and you say, well, things got not quite so great there. This looks like you're sitting there at a reproduction number of 1, which means that every person who has the disease is giving it to one other, which might give you pause when on July 1st you went to phase 3 reopening. That might be a little dicey, except the reality is harsher than that, because remember, infections occur about 2.5 weeks before they actually finally show up in those statistics, which means that these numbers correspond to infections that were doing this. And so what was really happening is that your number of infections were falling quite nicely until your phase 1 reopening. And at your phase 1 reopening, your reproduction number became about 1. You reached that point where one person was giving it to one person. And it was that case when you did your phase 2 reopening. We don't know what's happened since your phase 2 reopening because there's not any data to tell you. But if your phase 2 reopening was a reopening like every other reopening, there's a pretty good chance that your case numbers started going up, your infection rate started going up, which means that when you did your phase 3 reopening, there is every reason to imagine that you are already starting to get into trouble and just made it worse. Now, people in Virginia who do this seriously understand this subtlety. It's why when you read the July 3rd COVID update out of the UVA, their key takeaway was much uncertainty surrounds the risk of a second wave as Virginia enters phase 3 of the Forward Virginia plan. Let's see what actually has happened elsewhere in the nation. I live in Arizona, which is kind of COVID central for the whole planet right now. Back in mid-May, we were thinking, hey, this is great. Our reproduction number was around 1. The decision was made to reopen. And sure enough, what happened? A matter of a few weeks later, well, instantly what happened is the number of infections started climbing. But a few weeks later, what we saw was the number of cases climbing. Exponential growth. Same thing happened for the nation as a whole. The red line shows the United States minus New York and New Jersey, who kind of got their act together early on. And what you see is that overall in the United States, we never got to the point that numbers were coming down, but we did get to the point that the number of new infections was pretty flat. But there was the big push in May. We've got to reopen. We've got to reopen. We've got to reopen. And so there we did. We reopened, and a matter of a few weeks later, there we see it. Exponential growth. Fast exponential growth. Right now, the doubling time for cases in the United States is about 2 weeks, which means that if there are 50,000 new cases today, 2 weeks from now, we can count on there being probably 100,000 new cases. And those 100,000 new cases correspond to the 100,000 new infections that are occurring today. COVID is an unwieldy beast that goes off like a bomb if you let your guard down. And I think Virginia may have already let your guard down. At the very best, and you open Fairfax schools, you might have only had a couple of people on a campus of 1,000. That's already bad because schools are places that COVID spreads like wildfire. By August 26th, I would bet you dollars to donuts that what you're going to see is you're going to see cases are already higher, they're growing, and unless you've shut down again, in which case opening schools is kind of moot, the situation is going to be bad. The thing that we have to remember that no one wants to acknowledge is that right now we are not the ones making the rules. COVID is making the rules. Everyone's tired of this. Everybody wants schools to open. Everybody wants the economy to reopen. But none of that matters because COVID just doesn't care. The fastest way to get schools reopened, the fastest way to get the economy up and running again, is to keep everything locked down as tight as we can possibly lock it down until we get case numbers down to the point that you can actually control them with contact tracing and other public health measures. Mm-hmm. And we're not there yet. So that's not a pretty picture, but that's reality. And that's what you have to have in mind when you think about reopening schools in Virginia in August. Thank you.
That was very enlightening. Are you taking notes? Are you adding comments to the chat? Do you have any burning questions that we are going to have answered later? Well, this is just your first reminder because I want you to make sure that you are taking all of this information in so that you can be the advocate when you walk out of this town hall. Okay, so we are happy to have the former commissioner of public health and a member of the steering committee of the Black Coalition Against COVID. He has so graciously taken time out of his schedule to come speak with us today. And I have to say on a personal note, I think Dr. Tuckson, I introduced you to two of my students from Wilson. And I know that they've told me that they're having a wonderful time with the conversations that they're having with you. Thank you so much again. And ladies and gentlemen, Dr. Reed Tuckson.
Well, thank you very much. It's an honor to be here. I am in common cause with you, with Liz, and with Josh. I was fortunate earlier in my life to be married to a woman who is a principal in the DC school system. My grandchildren live in Prince George's County, and my daughter-in-law is a teacher in PG County. I take this seriously. I want to give you 8 quick points in my 10 minutes with you, and I'm going to go very rapidly. Number one, the most important thing is that you cannot discuss school opening outside of the context of the presence of the virus in the community. You have emphasized that. That is important. As a physician and as a former health commissioner, this is really the key thing. We have to control the community spread if we're going to be able to open schools thoughtfully. And so I think that we realize that in DC, Maryland, and Virginia, they're trending upwards, although we have done a lot better in this region than the rest of the country. And we should be very grateful for that. But on Saturday, there were 79 new cases in DC, 835 in Maryland, and 904 in Virginia. And wow. So we have to remember that this ain't over. And we've got to follow the guidance. That's why we created the Black Coalition Against COVID. This is a grassroots community-based effort that is involving labor, ministers, our young go-go artists, returning substance abusers, you name it across our community. I won't have time to go into the Black Coalition on this call today because I have other information to share, but please go to our website, blackcoalitionagainstcovid.org. There you'll see, by the way, our town hall on labor that we did with the Coalition of Black Trade Unions on Thursday night. 2-hour broadcast, live town hall broadcast on WPFW. And if you go there next week, starting on like Tuesday, that whole session will be on our website. But the bottom line, this ain't over. We have to keep doing all the things that we are supposed to do. Number 2, we all, as you have said, recognize, and as physicians, we recognize schools do need to get open. We understand how important that is. The American Academy of Pediatrics has really made a strong statement that begins that all policy considerations for the coming school year should start with the goal of having students physically present in school. The prestigious National Academy of Medicine, the leading intellectual think tank for the nation. And I'm lucky enough to be a member of the National Academy. Just came out with a report that says prioritizing reopening schools for kids, especially K through 5 and students with special needs, is an absolute priority. However, they emphasize, but federal and state governments must provide substantial new funding to school districts if we're going to be able to get this done. Number 3, the challenge is balancing the risk. The World Health Organization has concluded that the virus is airborne and aerosolized in crowded indoor spaces with poor ventilation. The National Academy of Medicine states that no way is there to entirely eliminate the risk of spread. And so school officials must be in association, as you have indicated, with public health authorities and with government leaders to plan for the possibility that some students and teachers or staff will inevitably contract COVID-19 when we go back to school. This is a painful reality. So we have to balance that risk that we all know that kids are not doing well at home. They need to be in school, the safe place for them to be, the place that they get so many other things in addition to just education. However, that's got to be balanced on the reality that in this complicated geometry, this complicated calculus, that in fact, some people will contract this virus. Number 4, the risks are clear for 4 different communities. Number 1, to the community at large. The main question about schools reopening in the fall is really whether or not returning students could increase community spread. Well, kids, we know from the influenza virus, different than COVID, but the influenza virus, that they do in fact shed more virus for much longer periods of time than adults. Whether this holds true for COVID-19 has not yet been ascertained, and the question is still open whether children become infected without symptoms are still extensive transmitters of this infection. I am furious that the government, the federal government, has prohibited the head of the CDC from testifying in front of the United States Congress. This is the kind of question he is supposed to address so that we will have this information. Pay attention to this issue. We need to know the answer to the question about whether children who become infected without symptoms are extensive transmitters of this infection. A study from South Korea that I have read says that while children under 10 years old are less likely to spread the coronavirus, young people between 10 and 19 will spread it similarly to adults. So let's remember, when we're talking about opening schools, we're not just talking about a homogeneous population. We're talking about kids under 10 and kids over 10, 2 different populations with 2 different patterns of epidemiology. Number 2, the risk to family. Remember, people of color are more likely to live with a school-age child compared to their white counterparts. More than 3 million people aged 65 or older live with school-age children. And so we know in our community, we really are smashing together older adults with young children. The risk assessment to children themselves. Let's be very clear. There is a syndrome called multi-system inflammatory syndrome in children that is linked with COVID-19 infection. And this is concerning. There is a study recently done of 186 children and adolescents who had multi-system inflammatory syndrome from COVID-19 with serious life-threatening illness that occurred in previously healthy children. People who get this virus, we also are finding, are showing prolonged symptoms. So it's not true that it is universally the case where if you get the disease, get over it, you're fine. There are a lot of people who are having secondary consequences. And by the way, every single one of us has got to realize the absolutely outrageous behavior of the President of the United States, who went and tries to now undermine Obamacare with its pre-existing conditions. And now all of a sudden, he wants to throw that into a cocked hat. What do you think is going to happen to all these people that have gotten sick, recovered, but have secondary symptoms? And then there is the risk to teachers. 1/4 of the workforce in America, 1.5 million of the teaching workforce, 1.5 million teachers and associated teachers nationally are at heightened risk of COVID-19 complications because of their age or pre-existing conditions. So let's be very clear. Point number 5, as a physician, evidence is important to me. Several countries have successfully reopened schools after reducing infection levels in their community. and imposed requirements like physical distance and limiting on class size. And so Norway and Denmark, good examples, both reopened their schools a month after they were closed, after they were initially, and then when they initially opened them, it was for younger children, and they kept high school shut until later. They strengthened sanitizing procedures, kept class size limited. Children were required to be in small groups at recess. They maintained space between desks, and neither of them have seen a significant increase. But then you look at Israel. Not a single school, they said, was prepared. And so on June 3rd, 2 weeks after schools opened, more than 244 students and staff were found positive for COVID-19. 1,400 Israelis were diagnosed with the disease last month alone. And out of that, 47% of the total were infected by the coronavirus in schools. We've also seen some challenges in Canada. So we don't have rigorous scientific studies on the potential for a school-based spread. It's a mixed picture. It is not inevitably high risk if the right things are done. We need that congressional hearing. And what are the right things? Well, I won't have a chance to go through all of the CDC criteria, but let me just tick off a few that they were threatening to rescind, with this president saying that they were too difficult. So he's willing to play Russian roulette with our teachers' lives, our bus drivers' lives, our cafeteria workers' lives. But here's the thing. We've got to make sure that sick staff members and students are able to stay home, and that the teachers have the benefits to do that. Desks should not only be spaced apart, but all facing the same direction. Schools need to have physical reminders, markings on sidewalks and walls. Physical barriers like sneeze guards or partitions should be in place when you can't do the distancing. Facial coverings must be worn by students and faculty as feasible. And let's be clear, we absolutely know now that masks work. Cut out the nonsense about all this foolishness about whether I should wear a mask, is it questionable or not, and cut out the nonsense about I can't wear a mask because I think I have a pre-existing pulmonary condition. We've done the studies now, the data is in. I just saw an article in the Journal of the American Medical Association. It would be unusual for any of us not to be able to wear a mask because of some other element. We should be wearing them. Let me then say that I'm also appreciative of the CDC guidance to try to limit students from mixing with one another, having them eat meals in the classroom, not in a dining hall. Communal areas should be shut, including cafeterias. The CDC recommends that students eat in their playgrounds and playgrounds, being able to go outside, stagger the release of classes and arrivals and dismissals. Let's don't have overcrowding. Well, there are a lot of things in those CDC guidance, but I'm exactly at my 10 minutes. So I will be disciplined and stop. I urge you, read the guidance. But at the end of the day, this is a very hard call. I don't envy mayors. I don't envy health commissioners. I don't envy school leaders. I don't envy parents. This is going to be a risk assessment exercise of how much risk are we willing to tolerate. Not going back to school is bad for kids. As a physician, I understand that. Opening too soon is bad for kids, parents, teachers, and the society. Those have to be weighed. And at the end of the day, there must be the resources that allow all of the things in that CDC guidance, 9 of which I just ticked off, and there are several more. All of those must be in place. And if they're not, then the people who are ordering these children back into these schools really, really have to look in the mirror and ask themselves, how could they make money the reason for trading the health of our kids? I don't believe that any of our public officials, whom I happen to like and respect, that they would ever let that happen. Thank you.
Ooh, I don't even know where to.
Hi, this is Glenda Fu-Smith from Dreams for Kids DC. We are a local nonprofit that empowers youth with disabilities, both physical and developmental, through free adaptive programming. I am the executive director, Glenda, and COVID has affected our community because we usually hold all of our programs in person. And since March, we have been pivoting by providing online virtual clinics for our kids, everything from adaptive yoga to dance to a virtual prom. I think for us, we have noticed that our numbers have certainly decreased since we have moved everything online. But for the safety of our families and our participants, we are not ready to meet in person yet. We are hopeful that a cure for COVID will be found soon so that we can once again be in person and have our programs again. Only when it's safe.
Thank you, Glenda. And Dr. Tuckson, I'm floored. You did a mammoth job. I see some applause and everything. I'm telling you, that was awesome. The 8 points that you gave us, I was trying to write them down, and I was getting stuck because I was listening so hard that I got stuck on a couple of them. But I want to say thank you for the wealth of information. Our next presenter is going to give you just about another big helping dose of information also. Kelly Trotner, I hope I pronounced her name correctly, is from our parent local, AFT. She is the Director of Nurses and Health Professionals. She is also a practicing attorney. Kelly is going to impart knowledge about school safeguards. It's a little bit that Dr. Tuckson left off. I think Kelly's going to pick up. And remember, I told you that this is interactive. All of the questions, I'm seeing a lot of good comments and questions. Please make sure to keep them in the chat. Thank you. Kelly?
Thanks, Tina. Thank you, President Davis, and all of the WTU members who are on the line today. Wow. Dr. Tuckson was pretty fantastic. A lot of the things that I'm going to say will just reinforce the ideas that he put out. I'm just going to go through a lot of the things that we are seeing across the country right now as being challenging for our affiliates who are both at the table with management and trying to help devise plans, and those who it sounds like in your case are closer to being shut out in the planning process. So the first thing I want to talk about is community spread. So looking at what sort of threshold should be in place in order to reopen schools, and really looking at how containing the transmission of the virus is happening in the communities is one piece that's very important for plans. We're getting ready to update our ReOpen plan, which is on the AFT website. And one of the updates is going to be related to community spread. And what we've done is we've looked at the ReOpen plans that governors in all states have put out and tried to pull from those the most practical and also protective. So what we're looking at right now, and this is a totally a sneak peek. Randy hasn't even approved this yet, but we're looking at calling for a demonstrated decline in new cases and hospitalizations for at least 14 days. And this is in a public health jurisdiction. A positive test rate of less than 5% in that jurisdiction, and a transmission rate of under 1, which the one speaker on the video was talking about the transmission rate. That means if one person one infected person transmits the virus to one person. So when you hear a transmission rate, that's what that means. And also a presence and a robust presence of a workforce that is tasked with testing, contact tracing, and the ability to offer support to people who are in quarantine and isolation when they're either suspected or have tested positive for COVID. That requires a robust public health infrastructure. In the AFT's plan, we are calling for a designated educational point of contact from at the state and the local levels with the corresponding public health agencies to really help provide support to school districts in implementing effective disease surveillance, the tracing and the isolation protocols for people who are suspected to be infected or who are confirmed to be infected, and all of the things that will help prevent spread within a school if there's a positive test. Public health tools that we've called for, we're calling these public health tools that we've called for: physical distancing. Our plan calls for a minimum of 6 feet. That's present in the CDC guidance. The World Health Organization previously called for 3 feet. We saw that recently in the guidance that was put out by the American Academy of Pediatrics, and we actually are in very detailed and close discussions with them, so much so that we released a statement with them and the superintendent's group and the NEA week before last. So physical distancing, very important. I won't go into too much detail because I have a short amount of time, but a lot of the plans are doing a lot of different things to ensure physical distancing related to scheduling and structuring the space. The bottom line is, in a lot of places, it's not going to be possible in those places where they're calling for 5 days in school because they need more teachers and funding is getting cut, not increased. So that's a big challenge. Hand washing. Students and staff must have access to fully stocked hand washing facilities throughout the day. And hand sanitizer should be available when hand washing facilities aren't immediately available. Chicago public schools, for example, this is a challenge because they don't even have hot water in a lot of their buildings, and they're always having to ask for soap. And this is pre-pandemic. So it sounds like you may have some of those same issues in buildings in your district too. Face coverings and personal protective equipment. Cloth face coverings are recommended as a simple barrier, and that really helps prevent the respiratory droplets from COVID from traveling into the air and onto other people. You've probably all heard this. If you're wearing a mask, it's not protecting you, it's protecting others. So the risk of transmission is very much reduced when we all wear a mask.
Mm-hmm.
Sanitation and cleaning. Districts need to establish protocols for routine cleaning and disinfection of all high-touch surfaces in buildings and on transportation vehicles. One of the things that we've been doing a lot of work around and supporting affiliates is that all cleaning and disinfecting products must meet the EPA requirements for COVID-19. It's a virus that it responds well to regular cleaning products that are normally used. You don't need to you don't need to spray everything off with bleach constantly, but staff should be properly trained on how to use these products and protect themselves. And at a minimum, districts should all comply with the CDC's reopening guidance for cleaning and disinfecting spaces and workplaces and schools and businesses. I don't remember what the whole list is. Ventilation and building systems. So having proper air circulation and filtration in indoor environments is necessary for the control of the spread of all viruses, including COVID. Districts should establish protocol for inspecting, for repairing, and providing maintenance on ventilation systems within their buildings. The organization that has the best guidance, we believe, on this is the American Society of Heating, Refrigerating, and Air Conditioning Engineers, or ASHRAE. They have some great guidance that's very useful, and we're happy to provide this to your local leadership should you need it. And then in general, ASHRAE recommends establishing enhanced inspection and maintenance of ventilation systems, in addition to increased ventilation and filtration measures. And in some places, and maybe this applies to some of the buildings that you're in, there should be consideration for buildings without centralized systems. So keeping windows open and allowing for fresh air exchange to happen in occupied spaces is really important. In rooms where there are window air conditioning units, those should be adjusted to maximize the fresh air intake into the system, and the blower fans should be set at low speed and pointed away from the people in the room to the extent possible. Sorry, I'm distracted. I've got like a huge downpour happening here. And on the issue of resources, Dr. Tuckson mentioned resources and funding. Schools not reopening forever, we know, is not an option, and neither is risking the health of our students, staff, and our communities. So really looking to, there's funding needed to increase the technical capacity needed for people learning remotely. And then all of the things that I just mentioned, all of those things cost money. We need more people, we need more resources, we need more things. So the HEROES Act that we've been pushing from the AFT end of things, the Senate to pass, we will continue pushing that. And I'm sure that you've gotten no shortage of communications from us and probably your local on that. On the issue of accommodations, I saw a couple of comments in the chat box. Our position is that staff who are at high risk for serious health problems or death if they contract COVID-19 should have access to special circumstances or workplace adjustments. Dr. Tuckson mentioned the Kaiser Family Foundation piece that found that roughly 1 in 4 teachers have a condition that puts them at higher risk of serious illness from COVID. So we're working on that stuff as we can legislatively. That's a real challenge right now. So if, anytime you can get, get a seat at the table, that is one of the most important parts. And Randy has us working really hard on that. We have a few pieces. I know your leadership has probably gotten them guidance on the law related to the Americans with Disabilities Act, the Family Medical Leave Act, local laws. I know DC has more generous rules than the federal versions of those laws, but we're going to have to go beyond what the law provides, because there are a lot of people who don't currently fall under the categories of being in a protected class for those particularly the ADA, but and the other piece is the case law just doesn't contemplate a pandemic, and certainly workplace accommodations like remote learning in all areas of law except for tech law. Probably the law is always lagging when it comes to technology. So remote work arrangements, there's a challenge there. So that's going to be there's going to be a lot of litigation happening there, and it's not going to happen fast enough for all of you. So please know that at the AFT, we're doing all that we can to try to protect those of you who are in that high risk situation. And just to reinforce again, collaboration between education and public health. We definitely believe that governors should establish, or in the case of DC, the mayor should establish dedicated public health personnel in both to sort of liaise between education and health. So schools don't have to try to call somebody who, they have to leave a message and wait 2 or 3 days because, public health agencies are understaffed just like in education. So, really looking at those sorts of things. I probably could go on and on about this for hours, but those are the big things that we're looking at right now. And I'm happy to take any questions. And thanks again for having me.
Kelly, between you and Dr. Reed, Dr. Tuckson, I don't know, it's just an overwhelming, just so much information. I have 2 questions. One is, and I don't know, either one can field this question. What recommendations do medical agencies propose for responding to COVID outbreaks in school?
Why don't you go ahead first? Oh, okay. So what kinds of recommendations do we have for responding to COVID outbreaks? So one of the good things is that the contact tracing programs are beginning to step up pretty well. I know, at least in the DC area, that they have been really doing a pretty good job of trying to get the contact tracers hired and trained. And I've talked with a number of them, and I think we're getting good leadership in that area. But here's the thing that I think is the most important, because your question is so important. We, especially people of color, let's be honest, we have a tendency not to like government officials or workers coming into our business and asking us lots of questions about our personal life. This is something that we're going to have to get over with, because if the one thing I learned when I was health commissioner in DC at the height of the HIV epidemic, that was the most important tool we had, was the contact tracing, being able to identify cases and then have a team of trained, sensitive, caring people from the community to be able to reach out and try to find out who were they in touch with, and then be able to counsel those people who may be at risk and keep this thing from spreading. So I think of all the things I can think about in answer to your question, it really is being able to test combined with contact tracing, and we need an activated community that's willing to be participating in that effort.
Thank you. Kelly, did you want to add to that, or?
I totally agree 100% with Dr. Tuckson, and I think John Hopkins has a program where they're training people to do contact tracing. It's actually a free program. One of the things that we're working on, and it's very, very preliminary, I'm not sure that we're just trying to find a partner right now, is we're trying to find a partner to launch a program with us so we can train some of our paras to do contact tracing. So in the districts where they are 100% remote in the fall, we can find some sort of work for those people who wouldn't otherwise be able to work.
Oh, awesome idea. Awesome idea. Awesome. I hope we find the money for that. Also, there's one other question that I do see in here. And it's two of them really. Is the data on new cases going to be available and accurate with the new reporting protocol and lack of info going to the CDC?
What this question is referring to is that the normal way in which hospitals report their information was going into a CDC site and then made transparently available to all stakeholders so that we could keep track. Now, with whatever is in the mind of this president, he has now ordered that ceases. It doesn't go to the CDC anymore, but it goes straight to his office, someone in the White House who is going to be doing it. I think now the backlash has been so vicious and so fevered about this decision that I think they're modifying it. And from the last I read is that I think it's going to be back on the CDC website. But the premise of this question is the right premise. Can you trust the data? Can you trust the data from somebody who continues to argue about not wearing masks, who keeps telling us that everything is wonderful, who tells us that today Dr. Fauci is an alarmist, unquote. So I think we always have to be very cautious about the data, and we'll keep our eye on it. But at least because of the protests that have occurred from the health community, I think we're going to start seeing it back on the CDC website.
I hope so. I hope so. I see Kelly is nodding. Yes, this is true. I'm going to take one more question because we really want to move on. DCPS has required all of us to learn how to contact trace. How do you feel about teachers and principals being contact tracers?
Kelly, do you want to try that?
When? I mean, contact tracing, like true contact tracing, and Dr. Tuckson will know this way better than I, but you basically have to identify all of the close contacts that someone has had within the past 2 weeks, 2 layers back, and then you have to go another layer back for all those people. So I don't see how teachers are going to do that. I don't know.
I certainly agree and understand that we are asking our teachers to be everything to every single social challenge in our nation. We can't ask teachers to do everything. Now, if this intent was that teachers would be more sensitive because of this training to what's going on in terms of the spread of the disease and being sensitive about identifying students or fellow teachers early and being able to cooperate, if it's to sensitize people to participate in the process, well, then great. But I'm certainly sure that nobody expects our teachers to suddenly become trained health professional epidemiologists. That would be a little beyond the pale.
I thank you for saying that. It is recorded, yes. because we did have to go through that training. It was yeah. But you know what? We don't have a lot of time there are a ton of questions in this chat. And ladies and gentlemen, thank you so much for putting them there. I remember I told you this was going to be interactive. And you have been interactive with us. Thank you. And if you want to look at the chat, please do so. There are some wonderful questions in there that I'm not going to be able to get to all of today, but definitely we're going to make sure we get through them. See, I told you we were going to inform and educate. What happened? We just informed and we just educated you on some of the things that are some of the reasons why we cannot go back to in-person teaching until this is quelled. Now we're going to empower you, and you will begin to take action. Are you ready, Liz? We are now welcoming our WTU president, Elizabeth Davis, who will speak about the budget's inability to protect the students, the staff, and the teachers.
Thank you, Tina. I did not know that you were such a radio host and moderator. You are doing an amazing job. And Reed, Kelly, thank you so much. You know, I was sitting here thinking about the teachers calling me about taking the webinars on contact tracing, and I thought, you have got to be kidding. So please, there's no way possible you can teach and do that as well. But around the issue of the budget, Tina, and I was sitting here reflecting on the number of substitute teachers that have expressed interest in being trained to become contact tracers. We have over 800 in a pool of active substitutes. And it's just a matter of the school district just looking there. They are looking for work to do, have already expressed interest, but for the school system to find the funds. And of course, our chancellor has indicated to the mayor and the council, for whatever reason, that he has adequate funds to reopen. I don't understand why, but I happen to know that he doesn't. We know how our schools closed as a result of the pandemic. We knew how many of our students were out there without access to Wi-Fi, technology, teachers who were basically teaching from their living rooms, bathrooms, kitchens, any place they could find, buying resources, connecting with their students, and in some cases, teachers who actually delivered devices to their students who did not have access. So our teachers have already gone over and above the call of duty. When I look at what teachers did in this school district in the process of transitioning from brick and mortar teaching to distance learning within a matter of 5 days, plus their weekend, which was supposed to have been their spring break, but they did not miss a beat because teachers basically know how to make do with what they have. But we should not continue that trend of asking teachers to do that. If we really want teachers to be able to focus on quality teaching and learning, focus on what supports they need in order to make reopening, distance learning effective, then we need to listen to them because they are truly the experts. However, we're still helping our school district leaders and our city leaders to understand the need to engage with teachers, to perceive them as the professionals that they are, who understand students, teaching and learning better than anyone they could ever hire. Mm-hmm. And we have basically for the last 2 or 3 decades, we have left teachers' voice out of the conversations and decision-making around education issues. We have got to redirect, we've got to rethink that, and we've got to look to the most valuable resource we have and knowing how to transform our schools into basically facilities and institutions that where all kids will have access to learning, where teachers will be supported and feel respected. The budget issue, we already know that we have inadequate funding in DC public schools. We've had it for decades. There was an adequacy study done in 2013 that says DCPS has not kept up with the cost of living in over 3 decades. So it's time for us to get in lockstep. I'm very grateful to the mayor for allowing us to maintain a status quo budget for this upcoming school year, but that is basically what it is, a status quo budget, which will allow us to maintain what we had, which was already inadequate but she did not slash us and cause us to have to lose a lot of staff. I am very, very unsettled, however, about the fact that we're losing school librarians. At this point, the chancellor has rendered school librarians as non-essential.
Yep.
As a result, 23 schools have written their school librarians out of their budget. 21 of those schools are in Ward 7 and 8. 2 wards in which schools have already been historically underfunded and under-resourced. You know, because basically we have sort of 2 school districts in DC, east of the river, west of the park, as a result of white flight, Brown v. Board, Bowling v. Sharp. But here's the deal. What we know is that we need to now begin to address the inequities in a very real way, not in a superficial way of just acknowledging, oh, isn't it a shame what's happening? Knowing that we have students who do not have access to online learning, knowing that we're going to reopen eventually with whatever model, and we're waiting to see what the mayor's going to announce. But even if it's a hybrid model, and God's spare, I hope it is not, every child will need to have a device. We know that. So why would we wait until August 31st to get that part right? That only solves a part of the problem. But as far as the budget, we have a chancellor who is supposed to be the most powerful advocate for our public schools than anyone else, saying that he has adequate funding for our schools. Now, I may not have been in a classroom for the last 5 years, but I was in one for 35. And I happen to know that we have underfunded schools for a long period of time. This is not the time for us to nitpick, for us to shortchange our students. We are basically funding dog parks, stadiums, bridges, and everything else in DC, Confederate monuments. Let's fund our schools. And I don't want teachers to begin to internalize this negative scarcity narrative. Oh, DC is starving for dollars. No, we're not. Now, I'm sure we've had a major reduction in revenues as a result of COVID, but we have a rainy day fund. We've had a reserve in DC for years. The mayor calls it the rainy day fund. Well, guess what, folks? It's storming outside. If there is ever a time for the rainy day fund to be used, this is it. So we need to be, as teachers, even though we may have, you know, a mayor and a chancellor who's saying, well, not yet for schools. I think you have enough to survive. That should be good enough. As teachers, 5,000 strong, we have got to stop saying, oh yeah, we'll make do. No. Our collective power and our voice means something. Now, I know that 40% of us live in PG, but the other 60% live in DC. We have a vote. We live in all wards. We elect council members. We elect state board members, and we elect mayors. And if we can do that, then we have got to begin to think about our collective power in finding representatives who are going to want to protect and preserve a quality public school system and not continue to feel as if we are in compliance mode, waiting to be told what to do, when to do it, and how it should be done. We're not victims. I know that we have an underfunded school system, but I also know that we have 13 council members who will listen to us if we speak collectively in one voice with our allies, with our partner unions, with our parents, with our faith leaders, and saying enough is enough. We care about our children, and how this city treats our children is a metric as to whether or not it cares about the community. So on the issue of the budget, we want the health of our students and teachers, number one, to be a priority. We want to ensure that there is going to be a one-on-one device for every student in DC public schools. Other school districts have been doing this for years. Loudoun County. There's no reason why we can't do it here. We're asking for $11 million extra dollars to fund the Eli grant, which will give us a 1-to-1 ratio of devices to every student. And of course, you know, even before we closed our schools due to the pandemic, our teachers were, you know, contacting the WTU about concerns, not about themselves. Before the mayor announced that we were closing, there were teachers calling me, Liz, what are we going to do about the students who can't access learning online? What about the students who can't have meals during the day? What about Wi-Fi? Teachers were the ones expressing this concern. They're the ones also who had ideas for how to remedy the problems. They don't come to the table with just a complaint about what's not working. Our teachers have been solution-driven for years, coming with recommendations. That report developed by the WTU ReOpen Task Force, 200 teachers worked on detail how to reopen safely. So we have professionals, experts, right here under our noses if we access the information and knowledge and skills that they have. So we want that Eli grant to be funded. We're not going to back up on what it takes to do that. We're working with some parent groups who are basically have crunched the numbers and basically informed the council and the mayor how many additional dollars we will need in order to make that happen. And of course, we also want to ensure that PPE, sanitizing, all of those things are going to be in place in our schools. And I know that you're hearing from the chancellor in the city that the schools will reopen safely. But if I ask any one of you on this call, what does that mean? I'm willing to bet you that I would not get one answer because you don't know what it means. What does that mean? Will that mean sanitizers in every classroom, masks available, individuals on staff in every school who can screen, test, take temperatures, a nurse in every building, social distancing in every classroom? You need to have specific details like that in order for you to know whether or not our schools are actually prepared for students and teachers to come to in-person buildings. And on my last note, because I see Tina's about to give me the call, the mayor had her press conference set up at Morey Elementary School near my home because she assumed that I was coming. And I already told her that I wasn't. However, the reporters attending that press conference were texting me the whole morning asking, Liz, why is the mayor moving? They also promised all of the reporters that they would be given a tour of the school. Okay. Well, the tour was canceled, and so was the location. They moved it from there to 441. So the reporters were confused, asking me. I said, I have no idea, ask the mayor. But here's the deal. I had to say to two of the reporters, Tom Sherwood and Mark Seagraves, I said, maybe the mayor simply was not ready for you to walk inside of a public school and see that the classrooms were not ready for social distancing, that the building was not clean, and that there was not enough of a staff in place for that school to reopen. And I'm sure that the idea to reopen and do that walkthrough tour for the reporters was a grand idea, but on that morning, for some reason, it was no longer a good idea. And I strongly suspect because what those reporters would have seen is what you saw before you left in the pandemic, and they could not run the risk of that happening. So, and of course, Tina, I'm hoping that some of the organizers, and I must say, if I don't get to thank you, Laura, Gladys, Steve, all of you who worked on pulling this event together and others, you've done an amazing job, and I do appreciate it. And I'm hoping that I'm going to have a chance before this program is over to hear from some of you as well, because I don't want to give all the specifics about the budget issues, the PPE. I'd like to hear from some of our teachers who are in the classrooms currently, who will speak to these issues much better than I. Thank you.
Well, thank you, Liz. And you left me speechless just then. You thought I was going to pull a rug from you. No, not yet. So, ladies and gentlemen, we have two videos that I want you to see. And these are from our community partners. And they're going to explain how COVID has affected them and what they do.
My name is Cheryl Brunson, and I am the treasurer of Brooklyn Manor Tenant Association. And I'm a little concerned about the breathing disorders with the children in schools. The school age, they have different breathing disorders such as asthma, bronchitis, and stuff of that fact. And the virus I think it tends to attack kids with these type of disabilities. However, I don't think it's safe for the kids to go back to school, nor is it safe for the teachers to go back to school because they don't have an antidote and they really can't assure the parents or the teachers that they're going to be safe through this pandemic. The kids should not go back to school and the teachers should not go back to school, only when it's safe. Bryant, and I'm the president of the Tenant Association. Like Mrs. Bronson explained, those are some of my fears, but with me, it goes even deeper. I'm 82 years old, and I have grandchildren and great-grandchildren. And I know when my children attend school, that they would interact with other people and kids, and it would be brought back into the home. There's no guarantee, and there's no cure for them or I. So my thing is that I would be very concerned, even with the teachers, because most of the teachers are 50 years old or over, and they won't be safe either. So the ones that are making these decisions, I wonder if they have studied this. And the schools, as they say, are very, very, very old. And it wasn't anything in place when the schools were closed down, and it hasn't been put in place right at this moment. So I say this for a fact, that my kids will not be going back to school only when it's safe.
Thank you. And you have experience with the school system, is that correct?
Yes, I'm retired from DC Public Schools. I'm aware of a majority of the buildings and what happens in the building, and the different kids that are involved in different places all over the city. There are kids that have been misplaced. There are people that are losing their jobs. There are people, there's no daycare for them. So I don't think who's making decisions is making the right decisions. So like I said before, like a lot of mothers and anyone else, I don't think their kids will go back only when it's safe.
Of course, the phone rings. I do have a house phone. I'm sorry. So here we go, ladies and gentlemen, look. Inform, educate, and empower. Thank you. Thank you, Liz. Thank you to Cheryl and to Minnie. Love them both. Here we go again. I need you. I need your fingers. This is our last poll. Knowing what you now know, do you feel comfortable sending your kids, your teachers, your friends back to the buildings? Yes, no, or unsure. This is an anonymous poll again. Okay. I was looking to see if I had another one, but here we go. So ladies and gentlemen, thank you so much. I know you may be still taking it. Everybody's good? We're good? We have one more video. This young lady is coming from, she's going to be talking about housing and how COVID has really affected not just schools, but also how we're living. I just want to say it's a good video. You're going to enjoy it. It's not very long. And there's also a little piece in there to jumpstart you to start activating your empowerment as far as being an advocate, going out, standing out, and being with us and saying, not until it's safe, only when it's safe.
My name is Lolita Ratchford. I am a board member of the DC Tenants Union. The DC Tenants Union was founded in 2019 to give housing tenants of Washington, D.C. a voice in the face of displacement in a city that is rapidly undergoing gentrification. The COVID-19 pandemic has led to sudden and severe reductions, and in many cases, a complete loss of income, particularly the self and/or precariously employed, frontline retail and hospitality workers, to which Black, Brown, and immigrant communities form a large part. According to Business Insider, Washington, D.C. is the fifth most expensive city in which to live in the U.S. Without employment and unable to meet rent or mortgage payments, an already cost-burdened community may finally succumb to their struggle against gentrification. In a world where the stock market continues to surge upward while employment opportunities continue to nosedive, the government's response has at best been weak and tepid, offering to the people barely a band-aid to place over a gashing wound. Many of the temporary measures put in place by the government to address the crises will expire on July 24th, leaving many people vulnerable to eviction. D.C., as a sanctuary city, should honor that status by recognizing the number of immigrant families who've been impacted by this crisis. That is why we are calling on the City Council to cancel rents for the duration of the lockdown and up to 90 days after. If the airline, hotel, and construction industries can receive $500 billion of bailout money, surely the government can mandate rent cancellation and save thousands of people of the city of Washington, D.C. from imminent disaster. We ask that you join us on Saturday, July 25th at a rally to cancel the rent, reduce the rent, or go on strike. The rally starts at 5 p.m. at Columbia Heights Plaza on 14th Street between Kenyon and Park Street Northwest. We hope that you will join us in telling the government that it is time to care about the people and not just the large corporations. Thank you. Only when it's safe.
Only when it's safe. Only when it's safe. I want to First, I want to say thank you to all of the presenters for the wealth of information and knowledge that has just been given to us today. I believe that we've met our objectives. They were to inform, to educate, and to empower through testimonies from various sectors of our DMV family, explaining through science, not politics, that we can only return to in-person learning, #only when it's safe. As Congressman John Lewis would say, it's time to get in some good trouble. Sign the petition that has been dropped into the chat, and then support, try to mobilize with us for our car caravan that is happening on tomorrow, Monday. There it is. The fight has to continue. We need you to stand strong with us. And we are now going to hear from our partners just to close us out. And I'm giving all of you 2 minutes, and that's it. Okay, so we're going to start with Liz. I'm going to let you have the last word, and I'm going to shut you off in 2 minutes, right? We're going to start with Josh. You have 2 minutes. Doris, John, Richard, and then Elizabeth.
Can you hear me?
Yes.
Okay.
Hi, Mr. Batchelor. I apologize. I apologize. I just saw Mr. Batchelor, and I see Mary Levy.
Yeah.
I apologize. That was me. I'm sorry. Go ahead, Josh.
I will take less than 2 minutes, and I will yield the balance of my time to whoever you designate. This has been a phenomenal program. I noticed that there were at some point over 300 participants. That is just incredible. And I just hope that everybody who has participated has been, in fact, feel informed, educated, and empowered. The only thing that I would ask, Madam Moderator, is that the next step here be, what is it that WTU wants its supporters and partners to do as we move into this decision that the mayor is going to make. What are our next steps? You don't have to deal with it today, but at some point, I hope that you will get the word out to all of your supporters as precisely what you want us to do. We're in this all together, and if we are to succeed, then let's get a plan and let's move that plan. Thank you very much.
Thank you. Where am I, Doris?
Yes. Okay.
Yes, thank you.
I just want to say quickly, thank you again for including me in this. The information given was just invaluable. So appreciate the speakers that you've had today. We had surveyed our members at one point to get their concerns and recommendations. And fortunately for us, one group of our members are the nurse managers. And they put together a document that's about 10 pages long of recommendations from the health experts on things that the system needs to look for. We shared that with our CEO, and I will gladly share that with any of you. I think it will be helpful. It's things that we had never thought of. Everyone was talking school-based administrators and teachers, but no one was really thinking about that health piece of it.
Right.
So a lot of the things that they put into place are things that are critical, but they're things that other people just didn't think about. So again, Liz, Richard, whoever, let me know. If you're interested, I certainly will share that. We have to keep working together. We may be, like I said, across the street from you, but our problems are definitely universal. And we have got to stick together and work on this. Thank you so much again for including me.
Thank you. Thank you. John. Yes, I did see. He's still on mute. Okay.
There we go. Just to take a minute to say thanks for everyone being on this call, and thanks to the teachers for putting it together. The hotel workers stand with you. We are all on the front line in this virus crisis. So not until it's safe is the way to go. Thank you.
Thank you. Thank you. Richard.
Yes, thank you. I want to say thank you to WTU and to all my teacher friends for putting on this event. Hearing your concerns has helped greatly in aligning our arguments. Much of what you said will inform what we at CSO says. Let's continue to communicate union to ensure that what we say to management has the power of the entire building level staffs. And so again, thank you for inviting me, and I really look forward to working together on this project.
Thank you again. And Liz.
Thank you, Tina. I cannot, but first I want to thank the labor leaders that are on this call.
Mm-hmm.
We beat the bushes to try to get all of the members of the executive board, but I noted that after this meeting began, that the strongest leaders of that labor council, John Boardman, Josh, Richard, Doris, they are the most powerful and highly respected members of that executive board in the Central Labor Council. So it's no wonder that they're the ones who said yes to this, because they always understood the bigger picture. And I cannot say enough to thank Tina, you, Gladys, Laura, Ben, Brittany, and I know I'm going to forget some others, but the organizing committee and those of you who put this event together, I really applaud you for the work that you've done. And even though you have tortured me this week 24/7, it's been worth it. And I'm looking forward to the car caravan tomorrow. And of course, lastly but not least, I want to thank our members. Mark, it's good to see you and Mary Levy. And I know that there's some other state board members who are on here that I may be overlooking, but thank you for joining us. We look forward to engaging with you later. Mary, you have always worked and supported our WTU. Thank you for joining us as well. And I hope that you all enjoy the rest of your evening and the rest of your weekend. And I look forward to doing what Richard says, continuing to work together to basically build our capacity as a labor community, build our power so that we control the waterfront, not elected officials. Thank you.
Thank you so much. Don't forget, tomorrow is our car caravan, and the petition is in the chat. Ladies and gentlemen, it has been a great afternoon of of just being informed, educated, and empowered. Thank you again.
Thank you. Bye-bye.